So.
पहले तो आप जो चैट बॉक्स है
सर
उसको बंद कर दीजिए। बंद होता है?
ये तो बंद ही है सर, इसको खोलेंगे तो ही खुलेगा।
हाँ बंद है ना।
हाँ जी।
इसमें दो फाइल है, एक लेक्चर का एक डेमो का। कुछ नहीं है? हाँ?
नहीं सर, ये
हाँ।
ये तो फर्स्ट वाला सर, ये डेमो 1 2
ये फर्स्ट वाला। हाँ
फर्स्ट वाला सेकंड वाला दोनों सर।
फर्स्ट वाला और ये लेग डेमो 3।
ये वाला सर
3। हाँ तो जो चैट है वो दिखाई नहीं देगा ना? हाँ आपको
यहाँ से देखेंगे तो
आप ऑन तो नहीं किया हुआ है? रिकॉर्डिंग ऑन तो नहीं है अभी?
नहीं।
अच्छा तो कहाँ से देखेंगे?
ये ना सर, ये यहाँ पे।
हाँ तो उसको बंद है ना वो?
हाँ जी।
हाँ वो जो बीच बीच में मैसेज आता नहीं आएगा ना?
नहीं।
ठीक। अभी लेक्चर वाला खोलिए।
ये सर।
हाँ ये इसको वो दीजिए स्लाइड व्यू में।
अभी तो रिकॉर्डिंग नहीं डाला सर।
नहीं अभी नहीं।
ये है अभी 10 मिनट है अभी।
हाँ तो इसको स्लाइड व्यू में दे दीजिए। हाँ ठीक है। अभी रिकॉर्डिंग मत डालिए, आप रुकिए, मैं वॉशरूम से
हाँ नहीं बीज लगाया नहीं सर।
लगा दीजिए, ठंडा लग रहा है। अच्छा सुनिए, बाकी एक और बात था, ये भूपिंदर बोल रहा है उसका बेटा पॉजिटिव हो गया। भूपिंदर का बेटा कोविड पॉजिटिव हो गया। अच्छा किसी को बोलने लगा अभी तो क्या मेरी तरफ से भूपिंदर को फोन करके बोल दीजिए कि उसको बीएचएस में जाके उसका छुट्टी का जो है वो भराना है, ताकि छुट्टी का जो उसका जो फंक्शन है जो मिलेगा वो बीएचएस से वो बात करें, नहीं तो उसका तनख्वाह से पैसा करेगा, ये उसको बोल दिया। आपको ना ये फीचर थोड़ा इसमें आना चाहिए एक दो बार।
तो इनका हम तो ऐसे उन्हें भी बैठे थे।
फेस्टिवल में तो पर आप यहाँ अगर खुद बैठोगे किसी को बैठा दोगे ना तो अच्छा रहेगा। क्योंकि कभी कोई जरूरत पड़ जाता है तो
हम देखते हैं, पूरा इसमें देखते रहते
हाँ
हैं।
हाँ सब कुछ अलावा मैं आपको ये नहीं बोल रहा हूँ कि आप हमेशा बैठा पर थोड़े टाइम तक भी बैठा फिर आपका नाम से ना बोल दिलाता है कि आप नीचे नहीं हो हमारा फैसिलिटी में करें क्लास के समय आप नीचे नहीं हो कोई प्रॉब्लम हो जाता है मतलब मैंने उनको बोला नहीं ऐसी बात नहीं है मतलब मुझे हमेशा नीचे है मैं इसी मान में आपको बैठेगा चाहिए तो मैं उनको ये भी बोला कि जब जरूरत होता है एक दिन का आना तब ये बीच में आप लोग आके देख लीजिए
ये जो अभी रिकॉर्डिंग चालू नहीं है ना, ये बंद क्यों नहीं होता है ये
रिसर्च में वो किए नहीं है लोग, ये ना बुक से
तो हम लोग बैठेंगे कैसे? अब बोलिए मैं इतना लंबा आदमी हूँ, मैं बैठूंगा कैसे? मेरा पैर तो फिट ही नहीं हो रहा है यहाँ।
इसको सर आगे से ना मैं इसको जैसे क्लास करूँगा ना उसके बाद इसको निकाल दूँगा।
हाँ ठीक। अच्छा अभी आप कितना इसके हिसाब से चलेंगे?
अभी है
इसके हिसाब से चलेंगे तो आप इसको ऑन कर दो।
ऑन कर दे।
अभी कितना टाइम है?
अभी 3-4 मिनट।
हाँ ऑन कर दीजिए। Well then, students, good morning to all of you. Today is the second part of the lecture on connective tissue, and I would like to start my lecture now, and whatever queries at the beginning of the lecture, I would like to mention that whatever queries you have, you just you can WhatsApp me at the MBBS group, and I would be responding to those queries. So cartilage and bone, these are actually special connective tissues, and however, the special connective tissue is composed of the same elements which comprise the connective tissue in general. There are cells plus fibers, and there is also ground substance. So you can see over here. You can see over here. This is hyaline cartilage, and this is the bone. And hyaline cartilage, you can see the cells over here. These are the chondrocytes. You can see, and they are present in groups. This is separated by the matrix, and this matrix contains the collagen fibers and the ground substance embedded in the ground substance. So when we look at the histology of the bone, we see these are units called Haversian systems. There are about 3 to 10 lamellae of bone, containing between them the cells of the bone, which are the osteocytes. These small dots that you see, these have the osteocytes within them, connecting to one another, connecting to one another by means of canaliculi. These are tiny canals which are present within the osteons or Haversian system. And you can also see certain channels connecting one Haversian system with another, or they even connect the central canal of the Haversian system with the surface of the bone, and these are known as perforating canals, or also known as Volkmann's canals. So the unit of bone is the Haversian system, which is also now known as osteon, which is also currently known as osteon, and having a central opening or central cavity, which is known as the central canal or Haversian canal. Not central canal, it is known as the Haversian canal or osteonic canal, surrounded by layers of the individual lamellae. So let us look at the features of cartilage first. So when you look at the features of the cartilage, the first point which becomes very clear is that the cells are separated by matrix, and the extracellular matrix is much more in extent compared to the cells. So the matrix is much more in comparison to the cells. The components of this matrix varies between cartilage and bone. Obviously, bone will have the calcium phosphate crystals, which is also known as hydroxyapatite crystals, which are deposited within the ground substance. So that is the difference. But these components of the matrix makes the cartilage quite firm and the bone very rigid, and both of them, because of their firmness, they are able to form they are able to take weight. The firm consistency of the matrix allows it to bear weight, and that is why both cartilage and bone form the skeletal framework of the body. Initially, in utero and after birth, the long bones are mainly made of cartilage, but with the age, this cartilage is gradually replaced by bone. Important point to remember about cartilage is that cartilage lacks blood vessels, lymphatics, and also nerves. But bone has all these things, but bone has all the three things together. So we can say that cartilage is avascular, is an avascular tissue. You know that cartilage is covered by dense irregular connective tissue called perichondrium, while bone is covered by periosteum. We will talk, I will talk about this later. And please remember that connective tissue develops from mesenchyme, which is in turn developed from mesoderm or the middle germ layer. So we now know that the special connective tissues have cells within them. Here these are the osteocytes in the lacunae. These are the chondrocytes in the lacunae, and here in the cartilage they are in groups. In the bone they are individually placed, but they are communicating with each other by means of fine canaliculi, and the matrix is much more than what we see in the general connective tissue. And remember that cartilage is avascular but not bone. So you can see over here that initially a large part of the skeleton is made up of cartilage, hyaline cartilage to be more specific, and this is gradually replaced with bone in the adult, though at many places cartilage remains. One or two places I will mention here. At the end of the ribs there are elements of hyaline cartilage called costal cartilages which articulate with the sternum, and at the end of long bones there is articular cartilage. So the ends of the long bones taking part in synovial joints are covered with hyaline cartilage, thin strips or thin layer of hyaline cartilage, which is known as the articular cartilage. I will emphasize over here that articular cartilage is different from articular disc, which is present within the joint cavity, and these articular discs are generally are made up of fibrocartilage, in contrast to the hyaline cartilage forming the articular cartilage. So you have just heard from me that the ground substance is the matrix is very extensive in the special connective tissue, and there are two components of the matrix. One are the fibers, the other is the ground substance. So let us see what is this ground substance. If you remember in this small picture that I have put, which you have seen before, that there are in the loose connective tissue, for example, there are various types of cells, and these cells in addition to these cells there are also different types of fibers, and some of these you can see, these are collagen fibers. The thinner ones are elastic fibers, and in between them you see some empty spaces. This empty space is because the ground substance has been dissolved out during the processing of the tissue, but this ground substance is present in the small areas between the cells and the fibers. So what are the features of this ground substance? This is hydrophilic. It binds a large amount of water, and this is for the cartilage, not bone, and it is also transparent, filling up the space between cells and fibers. But which is true for for both cartilage and bone is that this ground substance is a mixture of three different substances. I have already referred to them in my earlier lecture. One is the glycoaminoglycans, the proteoglycans, and the third is the adhesive glycoproteins. Now let us know a little bit about these three different components of the ground substance: glycoaminoglycans, proteoglycans, and the adhesive glycoproteins. So glycoaminoglycans are long polysaccharide chains which form a dense viscous network. I am referring to cartilage now, remember, not bone. I will come to bone later. So glycoaminoglycans and also the general connective tissue. The glycoaminoglycans over here are dense viscous network. Why? Because this contains lot of water within it, which makes it little bit slippery, and this is the characteristic of the articular cartilage lining the ends of the bones taking part in synovial joint. Now I would like to clarify over here that all the three are present in both cartilage and bone, but what I have mentioned over here, that I am referring to cartilage alone, is this component of water which is present in the cartilage. Otherwise all the three components, I am clarifying, all the three components are present both in bone as well as in cartilage. So so these are long polysaccharide chains. The largest glycoaminoglycan, or GAG GAGs as these are called, is hyaluronic acid, also known as hyaluronan. And I will show you a figure of the hyaluronic acid. It is a very long polysaccharide chain and having a large molecular weight. However, other GAGs are much smaller in size, and they vary between 10 to 40 kilodaltons, and they are attached to proteins as part of proteoglycans. So when you look at proteoglycans, it is composed of GAGs bound to a core protein. So these are the GAGs which are bound to a core protein, and this together is known as a proteoglycan. Look, the proteoglycan resembles something like a brush, something like a coat brush or a toothbrush. So proteoglycans, the glycan part is coming from these GAGs, while the protein part is a separate part which is present over here, and this is known as the core protein. So hyaluronic acid is does not participate in the formation of proteoglycans. However, there are other GAGs which are participating in the formation of proteoglycans, and let us look at them. Dermatan sulfate, keratan sulfate, chondroitin sulfate, and heparan sulfate are some of the GAGs which are also present in the connective tissue. Now let us look at dermatan sulfate. You see the word D over here, I have put it in bold because it is present in the dermis of the skin. The T over here is due to the presence of dermatan sulfate in the tendon, that is the dense regular connective tissue, tendon and ligaments. So dermatan sulfate, you know now where they are present in the majority, to the majority extent. Keratan sulfate is present in the cartilage, keratin sulfate is also present in the cornea. So K actually is actually representing the cornea, which starts with a C, and cartilage, which also starts with the C. So K and C are pronounced almost identically, and so I have put it in bold over here. So next gag is the chondroitin sulfate. Chondroitin sulfate, I have put the C in capital because it is present extensively. It is present extensively in the cartilage. It is also present in the cornea. The presence of gags in the cornea is very important from the clinical aspect. I will refer to that sometime later. And apart from that, there is also heparan sulfate. Now, heparan sulfate is a gag which is extensively present in the basal lamina of the epithelium. If you remember, the basal lamina is within the basal lamina, which is secreted from which is formed from both the epithelium as well as the connective tissue. I need to make a small change over here. I had previously mentioned that basal lamina is connective tissue. So here you need to I need to modify myself and say that it is not only constituted by connective tissue, but also there are components of the epithelium which is present within it. And which is the gag predominantly present in basal lamina? Yes, you are right. This is heparan sulfate, which is present over here. So now you have an idea of the different types of glycoaminoglycans. Hyaluronic acid would be universally present in both cartilage and bone, as well as in general connective tissue, while the other ones have a more restrictive distribution, and you can see, and some of the tissues are very rich in these gags. Accordingly, I have mentioned them over here. So now let us look at the main proteoglycan which is present in the cartilage, and this is known as agrican. Agrican, just remember the name, agrican. And there is another type of proteoglycan I have mentioned over here called syndecan. This syndecan is present in loose connective tissues also, and this syndecan actually anchors the epithelium to the underlying loose connective tissue. So syndecan is also present, should also be present in the basal lamina, and it is crisscrossing the basal lamina, anchoring the matrix receptors. Remember, syndecan, agrican, they form matrix. So there are specific receptors on the cell, and these receptors on the cells, one class of them are known as integrins. So syndecan will bind with the integrins on the cell surface, and it will also bind with a adhesive glycoprotein present in the basal lamina called laminin. So let us now look at the adhesive glycoproteins. So why they are named adhesive? So their names are derived from their ability to bind cells, fibers and ground substance together. So these adhesive glycoproteins derives their name from this aspect, and these are composed of carbohydrate and proteins, and you can see important glycoprotein present in the cartilage is fibronectin. Apart from that, I have just mentioned about laminin, which is also present in the loose connective tissue, and it is anchoring the epithelial cells to syndecan, and syndecan in turn will connect it with the collagen fibers and with the collagen fibers. So basically the syndecan and laminin are anchoring the cells to the connective tissues in a very stable manner. Remember, in a very loose manner, not stable. I correct myself, it is not stable manner, in a little bit loose manner. And similarly, in the loose connective tissue, you see fibroblasts, and the fibroblasts are also anchored to collagen type 1 fibers by means of the glycoproteins which are present over there. So I have put a question over here, that what are integrins? Integrins, as I have mentioned, these are nothing but matrix receptors present on the cell surface to which the glycoproteins bind, and they connect this with fibers and with proteoglycans. So the matrix, fibers and the cells form a very are joined together to form a tissue. So that would answer the question that why the cells and the fibers and the ground substance do not fall apart. So I have just mentioned about the components of the ground substance. Let us look at the in a pictorial representation of the ground substance. So there is a close relation of the ground substance with the collagen fibrils which are present within the connective tissue. So here you can see that in the type 1 collagen fibril, remember, if you look at the individual biochemical component constitution of the collagen molecules, there are about 42 or 43 different types of collagen molecules, and these molecules come together to form specific collagen types, and these like you remember, collagen type 1 is having 2 alpha 1 chains of alpha 1 and 1 chain of alpha 2, so it is heterotrimeric, and cartilage has only collagen type 2. Cartilage does not possess collagen type 1. So you can see over here, these are the collagen type 1 fibers in the loose connective tissue, and these green chains that you see, these green chains are the GAGs, that is the hyaluronic acid, and to this hyaluronic acid the various proteoglycans, proteoglycans, that is having the core protein with the other GAGs, they are bound to this hyaluronic chain by means of link proteins, and in turn the fibroadhesive the adhesive glycoproteins, they anchor like fibronectin, like chondronectin. Fibronectin is present in loose connective tissue, while chondronectin is predominantly present in cartilage, and osteonectin is predominantly present in bone. So these anchor these components together, that is the collagen fibers, the hyaluronic acid chains, and with the GAGs, so that it becomes a very it becomes integrated into a tissue. So let us look at the clinical aspects of the ground substance. Clinical aspects are, I have told you that the GAGs bind water and lot of water, but this water is bound to the GAGs. But in addition to the bound water, there is some amount of water within the connective tissue which is free. I am talking about the loose connective tissue, I am talking about the cartilage, I am not talking about bone. So this water, this free water, is known as tissue fluid or interstitial fluid, which is present in the ground substance. Excess accumulation of the tissue fluid in the ground substance produces a condition called edema. So in heart disease, in kidney disease, there is swelling of the tissues, and this swelling of the tissues is due to the increased tissue fluid or interstitial fluid which is present within the ground substance. Now the ground substance which you see over here, it is in a continuous flux. It has been broken down and resynthesized, and the breaking down part is done by lysosomes within macrophages. So the components of ground substance like proteoglycans are broken down by lysosomes, which must possess the appropriate enzymes or hydrolases for breaking down these GAGs. So if due to a genetic defect these enzymes within the lysosomes are not present, then there will be excessive accumulation of the ground substance within the connective tissue. These form part of a disease called lysosomal storage disorders. Lysosomal storage disorders, and one example is the Hurler syndrome. Now in Hurler syndrome, at about the age of 30 to 35, there is clouding of the cornea and the patient ultimately becomes blind. Remember what I had mentioned in my previous slide, that there are two GAGs which are present in the cornea. One is the chondroitin sulfate and one is the keratin sulfate. So if these GAGs are not broken down and resynthesized repeatedly as per the requirement of the tissue, then this condition of corneal clouding comes up in the patients. Also remember that bacteria that produce hyaluronidase enzyme to break down this hyaluronic acid can produce more extensive infections in the body. So I come to the specific cartilages. So let us look at the hyaline cartilage, which is the most common type of cartilage. And where they are present? They are present in the larger components of the respiratory tract, like in the nose, in the larynx, in the trachea, in the bronchi. They are present at the end of the ribs, that is costal cartilages. They are present at the ends of long bones, that is articular cartilage, and they are also present between the epiphysis and diaphysis of long bones as the epiphyseal plate or epiphyseal cartilage. Now this is a hyaline cartilage. You can see here that the cells are present in small groups, and these small groups of cells are known as isogenous cell groups, or they are also known as cell nests. This is separated by the matrix. Now if you look carefully, you will see that the matrix is basophilic. The matrix is basophilic because collagen type 2 fibrils which are present in cartilage. Remember students, collagen type 1 is not present in cartilage. It is present in the bone, it is present in the tendons, it is present in the skin. Collagen type 2 takes up hematoxylin stain. So it is the matrix becomes basophilic. Further you can see that the matrix immediately around the cells are more well stained than the matrix in the remaining part of the tissue. So this matrix which is present within the cell nest, this is known as territorial matrix, while in between this is known as the interterritorial matrix. Now many of you would be wondering why the territorial matrix takes up more stain in the interterritorial matrix. The reason for this is there are much more amount of glycoaminoglycans which are present, like chondroitin sulfate, which are present around this cell nest in comparison to the rest of the tissue. So because of this excess amount of GAGs, which also is basophilic, the tissue around the cell nest becomes more basophilic, than the remaining part of the matrix. You also see that these are the cells of the cartilage are known as chondrocytes, and these chondrocytes are occupying spaces which are known as lacunae. And the most important proteoglycan molecule I have mentioned before is aggrecan. Multi-adhesive glycoprotein is mainly chondronectin. Remember fibronectin in loose connective tissue. And there is internal remodeling of the cartilage going on continuously, depending upon the difference in the body weight or difference in physical activity within the tissues. So let us look at one cell nest over here. You can see there are 4 cells in this, 4 chondrocytes in this, and they are enveloped by the territorial matrix, and little far out from them is the interterritorial matrix. You can see these cells are very much having the nucleus and Golgi apparatus, some RER smooth and rough surface Golgi apparatus, and some vesicles, glycogen granules are also present within them. But remember, because cartilage is, I have requested all students to send me the messages in the WhatsApp group, because answering to your queries it unnecessarily prolongs the lecture class. So I will answer your queries there. So these cells, remember, cartilage is avascular tissue. I repeat again, cartilage is avascular tissue, but not bone, not any other connective tissue. So why? Because cartilage is avascular tissue, so the cells metabolize by means of anaerobic glycolysis, and because they are because they don't have vascularity, so they grow to a limited extent. Remember also that if cartilage is damaged, as it happens in sports persons, then the cartilage cannot regenerate. The cartilage in many cases have to be removed. The cartilage cannot heal by themselves. They have to be removed, and otherwise the fracture site in the cartilage will come, dense connective tissue will fill up the gap. So they have very poor healing power, the cartilage. So here you can see this is you can see the number of cells. So number of cells can be up to 8 in one cell nest, and you can see the matrix which are present around the cell nest, and these are known as isogenous cell groups also. So here you can see the cartilage cells, and you can see the collagen fibrils. Remember, collagen type 2 fibrils don't usually form large bundles. Collagen type 1 form bundles, as you have seen in the areolar tissue, but not collagen type 2. And you can see the various proteoglycan molecules like chondroitin 4 sulfate, chondroitin 6 sulfate, which are bound to the hyaluronic acid or hyaluronan. Remember, this is also present over here, and it is quite universal in nature. And remember also that the adhesive which is adhesive glycoprotein, which is present over here, is known as chondronectin. So the cartilage is covered by a dense irregular connective tissue, which is known as the perichondrium. The perichondrium has 2 parts. The superficial part or the external part is having fibroblasts, and you can see the DCT refers to the dense connective this is the perichondrium. This is the perichondrium, not this. This is something else. So this is the perichondrium. The perichondrium has 2 parts: an external part which is made up of collagen fibers, type 1 collagen fibers and fibroblasts, and the inner part which is more cellular, and the cellular part is actually containing stem cells, progenitor cells or chondroblasts, which are present on the inner aspect of the perichondrium. And when there is necessity, these chondroblasts will divide to give rise to new cells. Initially, close to the perichondrium, you can see that the chondrocytes are flattened in appearance, but as the cells move towards the interior of the cartilage, they become more rounded, more larger in appearance, and thus their morphology changes as they proliferate, and they are located within the matrix. So, what is perichondrium? Perichondrium is dense, irregular connective tissue, and it covers the hyaline cartilage. Remember, there is an exception here. The only hyaline cartilage in the body which is not covered with perichondrium is the articular cartilage. The elastic cartilage also has perichondrium, but the fibrocartilage does not have perichondrium. These are very important things to remember in this regard. Coming to elastic cartilage, the elastic cartilage, in addition to the components of hyaline cartilage, the cells over here, the chondrocytes in the elastic cartilage, they are present singly or in pairs. They form, they are not present like 4, 5, 6 cells together, which is a difference from hyaline cartilage. So, the cell nest in the elastic cartilage contain fewer number of cells, and usually I have marked out one. You can see there are 2 chondrocytes over here present in the cell nest. So, there is a dense network of branching elastic fibers over here. So, there is the collagen type 2 fibrils are there, the gags, proteoglycans, etc., typical of the hyaline cartilage is also present. But in addition to this, this dark color is because of the elastic fibers. There is a special stain for elastic fibers. But if you take the elastic cartilage from the body and see it under the light, you will see that it is yellow in color, because the elastic fibers are yellowish in color. Remember also that elastic cartilage does not calcify with age. Hyaline cartilage has the property of calcifying with age. So, here there is another difference with hyaline cartilage. And what are the sites where they are it is present? Remember, the organ which produces voice, which is that organ? The larynx. Some of the cartilages of the larynx, like the epiglottis, is made up of elastic cartilage, and there are 2 small cartilages of the larynx called corniculate and cuneiform, which are also elastic cartilage. The organ which receives the sound, like the external ear, the auditory tube, they are also made up of elastic cartilage. So, these are places where elastic cartilage is present. Coming to fibrocartilage. Now, fibrocartilage, just like elastic cartilage, which was hyaline cartilage plus elastic fibers, here you have hyaline cartilage plus dense fibrous tissue. And here the cells are arranged in rows. You can see, though at few places they will form cell nests and having the lacunae, but here the chondrocytes are arranged in rows. You can see it very clearly over here, and they are surrounded by the matrix containing the collagen fibers. Now, I have mentioned over here that chondrocytes are distributed in rows or groups surrounded by small amount of cartilage matrix, and the cartilage matrix which is importantly present over here is versican. And the matrix, remember, in the hyaline cartilage the matrix was eosinophilic. Remember, in the elastic cartilage under H and E the matrix is eosinophilic. I just repeat myself. In the hyaline cartilage the matrix was basophilic. I gave you the reason. I told you that elastic cartilage also, the elastic cartilage, elastic cartilage and fibrocartilage, when you look under the, when you see them in sections under the microscope, they appear eosinophilic. So, so here what is the reason that the matrix of fibrocartilage is eosinophilic? the matrix or acidophilic, it is the same, acidophilic and eosinophilic. It is because majority of the fibers, yes, there are collagen type 2 fibers around the cells, but the majority of the fibers are collagen type 1 fibers. Remember, collagen type 1 fibers you could see under H&E stain, and they were they took up eosine color. They took up eosine color. So here, because it is rich in collagen type 1, so you get a pink appearance or eosinophilic appearance or acidophilic appearance to the tissue. Remember, I mentioned there is no perichondrium in the fibrocartilage. So chondrocytes are separated by dense regular connective tissue. So here here I'd like to just change this, that chondrocytes are separated by dense, it will not be regular, it will be irregular connective tissue. Chondrocytes are separated by dense irregular connective tissue containing type 1 collagen, plus it will contain fibroblasts. So there is a small correction over here. There is a small correction over here, and this fibroblast nuclei differ from the nuclei of the chondrocyte. The fibroblasts differ from the chondrocyte. Chondrocytes are present in rows. However, the fibroblast nuclei are elongated, flattened, spindle shaped, and present singly within the matrix. They are not present collectively as in rows over here. So all where are the places where you have fibrocartilage? You can't forget the intervertebral disc composed of annulus fibrosus and nucleus pulposus, which is having the fibrocartilage. And another place, another structure which is the best, one of the best examples of fibrocartilage are the articular discs. Articular disc, as in present in the sternoclavicular joint, as is present in the knee joint. These are examples of fibrocartilage. Now, as a general information, I'd like to tell you that cartilage grows by two means. One is the cells divide amongst themselves. We call this interstitial growth, and the other is cells grow from the surface, like from the side of the perichondrium. That is called appositional growth. Interstitial growth is more common in the young cartilage, in the young age. Appositional growth is more common as we age, it becomes more important. Remember, it is avascular tissue, so regeneration of cartilage is very poor. So let us look at the interstitial growth of the cartilage and also at the development of cartilage. Remember, cartilages develop from mesenchyme. Mesenchymal cells are star-shaped cells. You can see they have very long cytoplasmic processes which connect with the other cells, and there is lot of ground substance. Very few fibers are there, and hyaluronic acid is present to a large extent over here. One of the examples of mesenchyme is the Wharton's jelly I told to you earlier, present in the umbilical cord. So this mesenchyme, the mesenchymal cells retract their processes and transform into chondrocytes. You can see the round cells of the chondrocyte. The round cells of the chondrocyte, there is very little matrix, because of which it is known, also sometimes known as the cellular cartilage. In stage 3, these chondrocytes secrete matrix, separating them from each other. As a result of this, you will see very extensive matrix present between the chondrocytes. Now, in stage 4, each of the chondrocytes starts dividing. You can see mitosis occurring over here. They have started dividing, producing what we call as cell nest or cell groups or isogenous cell cluster, as a result of which you can see multiple cells. Then each of these cells will produce matrix and they will separate from the neighboring cells. So multiplication of chondrocytes. So these things, are happening in the postnatal life, while here you can see that mesenchyme is transforming into cartilage, very important during the growing phase of the skeletal system. So let us look at the appositional growth now. We have looked at the interstitial growth. Appositional growth of cartilages, you need to look at the perichondrium. You can see the superficial cells, superficial layer of the perichondrium contains collagen type 1 fibers, and there are nuclei over here which are flattened. These are fibroblast nuclei. The deeper one is more cellular, and though these are flattened, these are actually progenitor cells or stem cells belonging to the chondrocyte lineage, and these cells will divide to form the chondroblast, which are initially flattened, and then they will move into the matrix where they will form the rounded chondrocytes. So the cell growth is occurring from the periphery through the perichondrium. Now here you can see that the matrix immediately surrounding the cartilage cells, they have very little collagen fibers, but as you move away, the matrix contains very dense type of collagen fibers which is present. So this is the territorial matrix, and as you can see over here, this is the interterritorial matrix. Now I will just summarize the cartilage. It is a form of connective tissue, special connective tissue, composed of cells called chondrocytes, and there is specialized extracellular matrix. The extracellular matrix is very important in the cartilage. It composes more than 95% of the tissue. I hope you understand over here that how important or how extensive is the matrix in cartilage. It is composing more than 95% of the cartilage, and there is a large ratio of gags to collagen fibers. So more gags are present than the collagen type 2 fibers. Now when we classify the specialized, we actually classify the cartilage based upon the extracellular matrix. If it has collagen type 2 fibers with gags, it is hyaline cartilage. It is having hyaline cartilage plus type 1 collagen fibers, it is fibrocartilage. And if it has hyaline cartilage plus elastic fibers, then it is elastic cartilage. So the matrix is not only made of, majority of the matrix composes the cartilage, but the matrix also determines what type of cartilage it is. Accordingly, the cells are also named like chondrocytes over here. So this is just a representation to show you that the wet weight of cartilage is water. See how much is water, 60 to 80%. Remaining components are the collagens and the gags, etc. And the cells comprise only 3 to 5% of the cartilage tissue. Coming to bone. So the bone can be classified in two ways. You can see it under the light, and you can see it under the microscope. If you see it, the cross section of the bone, say the femur, you will see on the outer aspect of the bone there is very compact bone, very dense bone. This is known as compact bone, and inside this compact bone you will see the extensive cavities present within the bone tissue, and the bone tissue is composed of small thin trabeculae. The word trabeculae actually comes from, you can see a building over here standing on this beams. So these are beams or pillars. So that word trabeculae actually comes from the word beams, means pillars, and you can see these trabeculae which are present. They are joining up with one another to form a network within which the bone marrow will be present. Initially, in the young age, the bone marrow is mainly red in nature, red bone marrow, but after adolescence, majority of the red bone marrow disappears, except from the hip bones, except from the cranial bones, except from the ribs, and it is replaced by yellow bone marrow. The yellow bone marrow is very rich in adipocytes, so the fat cells, and these fat cells store, as I mentioned in my last lecture, it stores triglycerides which is a source of energy. So under the microscope, there are two types of bone. One is woven bone or primary bone. What is the difference? The collagen fibers are arranged in irregularly in all three dimensions. This is immature bone, the bone which is first formed during ossification. Afterward, this bone is removed and it is replaced by what we know as lamellar bone or secondary bone, also known as mature bone. All of you have read in your biology classes in your school that the bone is composed of units like this, which are called Haversian systems or osteons. There is a Haversian canal or osteonic canal in the center, which is surrounded by various layers of bony tissue, which are here known as lamellae, and between the lamellae there are small spaces called lacunae, which contains the cells of the bone. These cells are nothing but the osteocytes, and these osteocytes extend their cytoplasmic projections and communicate with other osteocytes or with the surface of the bone through small canals, which in turn which are called canaliculi. So these canaliculi and the osteocytes helps in maintaining the bone. If the osteocytes die, the canaliculi, this bone will also die. And remember, bone is a living tissue. If it was a dead tissue, bone will not grow back just like after fractures. So bone is a living tissue, it is a highly vascular tissue, and the covering of the bone, that is periosteum, has lot of nerve fibers. So the majority of the pain which is arising from bone is due to the extensive innervation of the periosteum covering the surface of the bone, that is the periosteum. So these are the classification of the bone. So what is the difference from the cartilage? Both are special connective tissues. The matrix is mineralized. The matrix contains calcium phosphate combined with calcium hydroxide to form specific type of crystals called hydroxyapatite crystals. I am sure you have heard this in your biology classes. And along with this calcium phosphate plus calcium hydroxide, there are also other chemicals like sodium, like fluoride, like manganese, which are present along with this hydroxyapatite crystals. So I would like to mention a term over here called osteoid. You will often hear the term called osteoid. What is osteoid? Osteoid is unmineralized matrix of bone. If the matrix of bone is formed which is not mineralized, calcium phosphate has not been deposited as of now, then it will be known as osteoid. Please remember this term, osteoid. It is extensively used in the clinical studies. So coming to the next slide, the bone has a covering. As I mentioned before, this is the periosteum. It is the dense connective tissue, dense irregular connective tissue. There are two layers of periosteum, as you have seen in perichondrium. Outside it, the outer layer is more fibrous in nature. The inner layer is more cellular in nature, and it contains specific types of cells called osteoprogenitor cells or stem cells of the bone. And whenever required, these stem cells will produce more bone as and when required. So from these collagen fibers which are present in the dense connective tissue, many of the collagen fibers enter into the bone. So as if they are anchoring the periosteum to the bone, and where there are tendons attached to the bone, more number of such fibers, collagen fibers, are seen going from the periosteum to the bone. These fibers, which are very special type of fibers, these are called perforating fibers or Sharpie's fibers. And what is endosteum? The inner aspect of the bone is also lined by very thin layer of connective tissue containing again osteoprogenitor cells, and this is known as the endosteum. The outer aspect is covered by thick layer of connective tissue called periosteum, having two layers. The inner surface of the bone is also covered by connective tissue, but it is very thin and mainly cellular, and it is known as endosteum. Why do you think nature has given periosteum and endosteum? Throughout our life, bone is being remodeled. Bone is taken out by osteoclast cells and redeposited by osteoblast cells. The osteoprogenitor cells transform into osteoblasts and produce bone tissue. So, and at each point of time, 5% of the adult skeleton is being remodeled. It is being taken out and then deposited. So remodeling of bone is very, very vital. Plus you can think when there is an injury and there is a fracture. So these periosteum and endosteums generate and supply stem cells which will produce bone. So you can understand why nature has given an external and an internal covering on the bone. Now let us look at the units of the bone. Now you can see this is one osteon. This is the Haversian or osteonic canal containing nerves and blood vessels and some loose connective tissue over here. These are the individual lamellae, and the lamellae are separated at places. They are separated to form lacunae, which contains the osteocytes, and these lacunae communicate with each other and also with the osteonic canal by means of this canaliculi. Now each of these lamellae, this is mineralized matrix, contains collagen fibers, but these collagen fibers are arranged in a very specific manner. In individual lamellae, the collagen fibers are arranged in a very specific direction, and in adjacent lamellae, these collagen fibers are approximately directed at right angles to each other. You can see one lamellae, second lamellae, third lamellae, the collagen fibers are directed obliquely, almost at right angles to each other. So these collagen, this is collagen type 1 fibers, these give the strength to the bone. So let us look, each of these is a lamellae. So what are the different types of lamellae which are present in bone? So different types of lamellae can be flat or they can be circular. The circular would be the ones which are lining the osteon, and the flat ones are those present towards the surface of the bone or towards the inner aspect of the external surface or internal aspect of the bone, where they are known as circumferential lamellae. They are not actually flat, but they are circular, but their diameter, the diameter of that circle would be very large compared to these. And also between the osteons there are remnants of previous osteons which have been remodeled, broken down by osteoclast, as a result of which remnants are present, and these are known as interstitial lamellae. So if I ask you what are the different types of lamellae, the answer would be there would be circular lamellae present around the osteons. There will be relatively flat lamellae which are present on the external and the internal aspects of the bone. These are this would be like wider diameter. We call them circumferential lamellae, and there will be also lamellae present between the osteons within the bone, and these are the relics or fossils of osteons which has been damaged or which has been remodeled earlier, and these are known as interstitial lamellae. Let us look at the cellular component of bone. So we have osteoprogenitor cells, students, but please remember these three types of cells which are present in each and every bone tissue. There is an osteoblast which produces bone, there is an osteocyte which maintains the bone, and there is an osteoclast which removes bone. So you cannot afford to forget these three main cells which are present within bones: the osteoblast, the osteocyte, and the osteoclast. And there are two other types of cells. One is the osteoprogenitor cells, which will transform into osteoblast as and when it is required, and one is the bone lining cells, which are present at certain on the bone. But the three main types of cells are this. Now if you look over here in this diagram, you can see that these are the osteoprogenitor cells which have transformed into osteoblast, and osteoblast will produce the bone. Once the bone has been formed, as you can see over here, this osteoblast will transform into bone lining cells. I have not mentioned it because it is not necessary for you. You can just tell that osteoblast will be entrapped by the matrix and will be turned into osteocytes. And there are also cells like osteoclast, which are very large cells over here, and they are removing bone. They are removing the bone, and these are known as osteoclast. So and you can see one individual lacunae in the bone where you can see an osteocyte which is having numerous cytoplasmic processes which are going out and which are communicating through gap junctions with the cytoplasmic processes of other osteocytes present within the bone. So osteoprogenitor cells are derived from the mesenchymal cells. Remember the source of the connective tissue, all connective tissue. So let us look at the various components of bone. I have looked at the cellular component. Let us look at the matrix now of the bone. So when you look at the matrix, there is an organic matrix, there is an inorganic matrix. Remember the inorganic matrix, which will be the calcium phosphate hydroxyapatite crystals. They comprise about 50% of the matrix. The remaining 50% of the matrix is the organic matrix, and 90% of this would be collagen fibers. Remember the specific arrangement of the collagen fibers in each lamellae of the osteon. And also there is a ground substance which comprises 10% of the organic matrix, and this has various types like proteoglycans, and this would be glycoproteins, and specific glycoprotein would be osteonectin, and bone specific vitamin K dependent proteins like osteocalcin, which helps in the deposition of bone. And there are also growth factors and cytokines which are present within the ground substance. So if I ask you what is the component of bone, you say cells and matrix. Cells are osteoblast, osteocytes, osteoclast. And if you look at the matrix can be organic, it can be inorganic. Both are comprising half of each. And if you look at the organic matrix, then the majority of the organic matrix is made up of collagen fibers. There is also ground substance which is mineralized, and the ground substance has glycoproteins, proteoglycans, and bone specific potassium K dependent proteins, as well as growth factors. So I will now describe each of these cells in detail. Look at this area where bone is being formed. So you will see that on one surface, I have asked you that to ask the question in the WhatsApp group, so that all the students will benefit from your question, and there may be similar queries in the other students who have not understood, and it will be I will answer those questions in the WhatsApp group for the MBBS students. Answering questions here unnecessarily prolongs the lecture class. So here you see this is the bone is being formed. On one side you can see these are very large cells which are lining the surface of the bone, and you can see that these cells are like cuboidal, or almost sometimes they are columnar in nature, and these are osteoblasts. They are producing bone. And on the other side you can see that these osteoblasts have shrunk and they have become almost flattened like squamous. They are inactive. This has become like these are the osteocytes. These are the osteocytes. I would say I would just put a clarification over here that these are osteoblasts, but these are active osteoblasts and these are inactive osteoblasts. I will not call them osteocyte. Very theoretically, critically speaking, I will not call them osteocyte at the moment. Once these cells produce the matrix, they are trapped by the matrix. You can see these cells which are trapped by the matrix. Once the cells are trapped by the matrix, you can call them as osteocytes. Their work now is to maintain the matrix. So osteoblasts are lining the bony surfaces, producing bone. And what is the characteristic? If you look at them under electron microscope, you will see they are having lot of rough surface endoplasmic reticulum. They have ribosomes, they have Golgi apparatus, and they have alkaline phosphatase. Now these alkaline phosphatase is present in the form of matrix vesicles. I have a figure, I will show it later to you. So these matrix vesicles acts as nidus or nidus on which the calcium phosphate deposit occurs. So these matrix vesicles are rich in alkaline phosphatase. So remember, osteoblasts are also rich in alkaline phosphatase because they are producing the matrix vesicles which contains this alkaline phosphatase. Remember the macrophages which are rich in acid phosphatases. So cytoplasm of the osteoblast is basophilic with a clear area close to the nucleus. Of course we cannot see them here, which is the Golgi apparatus, and it also contains PAS positive granules. What is PAS? Per-iodic acid sheaf. So PAS positive granules are present within the osteoblast, and these PAS positive granules are actually going to form the matrix later on. So these granules are present within the osteoblast, and they stain with the per-iodic acid sheaf stain. So when inactive, they form flattened cells and over here, but whenever required, osteoprogenitor cells, but whenever required, so instead of osteocytes, you call them osteoprogenitor cells, and the moment they are trapped inside, now you call them osteocytes. So formation of osteoid, remember what I mentioned, non-calcified matrix is osteoid. So you can see over here that the osteoblast lining the bony surface, and they are producing matrix which is getting trapped, and along with the osteoblast you can see these large cells. These large cells having multiple nuclei. They can have up to 10 to 15 nuclei, and these are formed by the fusion of the macrophage cells, macrophage-like cells derived from the bone marrow. So these osteoclasts, these are examples of the mononuclear phagocytic system told to you earlier, and here they are very large cells. They have multiple nuclei, so they are also known as multinucleated giant cells. Multinucleated giant cells. So how does mineralization occurs? I will not go into details over here. I will just mention that the osteoblast release matrix vesicles which are rich in the alkaline phosphatase, and also there is a chemical present over here called osteocalcin. The osteocalcin helps in the deposition of calcium around these matrix vesicles, and this helps in the mineralization of the osteoid within the bone, within the newly formed bone. You take out the calcium. You can take out the calcium in the bones by means of dipping it in a decalcifying agent like EDTA. You all know about EDTA from your chemistry classes. So if you put a bone which is very rigid and hard into EDTA solution, and after about a month or so, most of the calcium will be removed out, and the bone becomes very much loose, and you can tie the bone into a knot without any problem. So it is the mineralization of the matrix which makes the which makes the bone rigid and able to take the body weight and of the individual. So let us look at osteoclast. So this is a figure of an osteoclast. What are the features? I have already mentioned it is a multinucleated giant cell. Where it is present on the cell surface, and where it is present on the cell surface, that surface exhibits irregular appearance like this due to microvilli. This is known as ruffled border, and thus the osteoclast is a polar cell. Cell polarity, you understand. Previously you have been told about cell polarity in the epithelial lecture. So here only the surface which is resting on the bony surface develops this ruffled border, and this ruffled border is enclosed within a cavity which is called the resorption bay or Hoship's lacunae. Now you can see the small vesicles within this. These are nothing but abundant lysosomes which give the osteoclast an acidophilic appearance. And remember, it is one of the components of the mononuclear phagocytic system. So it contains acid phosphatase. It will stain with acid phosphatase. So these are the features. And it also, one last feature, it also has an actin filament network which seals the periphery of the ruffled membrane, and within this the osteoclast releases protons which dissolves the bone, and also various types of hydrolases which dissolves and destroys the collagen fibers, etc. So the bone particles are engulfed by the osteoclast and then released into the towards the free surface, where there are blood vessels which will pick up the degraded bone particle outside the osteoclast. So osteoclast, you can see how it's a beautiful figure where you can see the osteoclast. These are the microvilli, and it is resting on the bone, and how it has scalloped out, just like you scallop out an ice cream with a spoon. It has scalloped out bone in this way, and it is moving. So it has moved from here to here, and as it is going, it is removing bone, and that is why it is the cell concerned with the removal of bone, and it is the cell concerned with extensive osteoporosis, which is happening in older people. You know now that with the advent of modern medicine, people are living longer, but there is a drawback of this long life. The bones become very brittle, and these bones become brittle because the bone formation is not so much as there is bone removal, bone resorption, and you also know that bone formation is assisted by the parathyroid hormone. Bone removal is assisted by the parathyroid hormone, which will activate the osteoclast, and the osteoclast will remove the bone and increase blood calcium level in the blood. And there is another hormone which is called thyrocalcitonin, released from the parafollicular cells of the thyroid gland, which inhibits the osteoclastic activity. So you understand now that a special type of calcitonin derived from the salmon fish is used to treat osteoporosis. It's called metacalcin. When you give this to the patients who are suffering from osteoporosis, then this stops or it reduces the osteoclastic activity within the bone, and helps in the less removal of bone from the periphery. Now, osteoporosis is more common in women than men. There is a simple reason for that. there is more bone tissue in males than females. As a result of which, when the bone removal occurs by the osteoclast activity towards the later part of our life, the bones in women become more fragile than in men. But remember, the fragility also occurs in males, also occurs in male bones, and both male and female suffer from very frequently from fractures of the bone in the old age. So you can see now a H&E stain slide showing the osteoclast within the resorption or Hochschiff's lacunae, and you can see the ruffle border over here, and you can see the multiple nuclei which is present within the osteoclast. So you can see very nicely the actin network over here at the periphery, and I will just these are very large cells with multiple nuclei. They are developing in a unique fashion from the macrophage cells, and characteristic histological features are resorption base, clear zone at the periphery filled up by actin network. They are eosinophilic because of the acid phosphatase. They have numerous lysosomes, and they interact with osteoblasts, because parathyroid hormones actually don't act on the osteoclast directly. They act on the osteoblast. Which now releases a factor which activates the osteoclast, and the osteoclast starts removing bone more vigorously than what it was doing before. That is why you need calcitonin to stop this osteoclastic activity in the older age group. So suppose osteoclasts are non-functional. So I have told you, you might be thinking that the osteoclast is a very kind of criminal type of cell, or a very bad type of element in the bone, because it is removing bone all the time. But there is a disease called osteopetrosis or marble bone disease, which is where the osteoclasts do not work properly. So as a result of which, because the osteoclasts are not working properly, I will just finish in a couple of minutes. So the bone marrow cavity shrinks, and the bone marrow also is reduced. As a result, these people who are suffering from the osteopetrosis due to defective osteoclastic activity, they suffer from anemia, and also they have agranulocytosis, etc., at a later stage, because of the reduced formation of the cells in the blood. So remember osteopetrosis or marble bone disease. Now osteocyte, the traps osteoblasts within the from osteocytes. The osteocytes I have mentioned through caniculum, they communicate with each other, just like this figure where the people are holding hands to form a queue, and and also they develop processes which communicate with other cells. They are smaller than the parent cell, osteocyte, and much less basophilia, few organelles, and metabolically, but don't think that they are not active cells. They are metabolically active, and they are involved in mechanotransduction, that is in weight transmission. Suppose today some of you decide to do some gym activity, or you decide that I will play some games now. I encourage all the medical students to play games, because continuous reading and intake of junk food is producing lot of lifestyle diseases in the medical students. So I will urge all the medical students to take part in some kind of activity, like badminton, like football, like basketball, etc., like even table tennis, and so that their bone growth and their bone deposition is healthy, and this will burn up all the junk food that they take in the intermittent period. So if there is increased stress on the osteocyte, then it will promote bone formation. If there is decreased stress on the osteocytes, then it will produce bone loss. So this is the osteocyte. Osteogenesis is by two methods. One is intramembranous ossification, one is endochondral ossification. Intramembranous ossification is where mesenchymal cells form a membrane, condense into a membrane, and within the membrane, some of the mesenchymal cells directly transform into osteoblast, and start laying down bone. And these are known as ossification centers, and intramembranous ossification occurs where it is happening in the flat bones of the body, like for the cranial bones, like for the mandible, like for some of the other cranial bones like the maxilla. Flat bones of the body grow by means of intramembranous ossification, while long bones and short bones of the body grow by endochondral ossification, that is ossification within the cartilage model. There is a cartilage model of the bone, and this cartilage model is gradually replaced by bony tissue. So I think I have a better figure of this, so you can see how bone is being formed. So I will just go to the next slide, and the last slide. You can see over here that in the cartilage model, the first sign that bone is going to be formed is this periosteal collar or bony collar, which is formed around the periphery of the diaphysis. You can see very nicely over here. You will see it very nicely in the slides that I show you in the demo. And this periosteal collar from here, because the periosteal collar is formed, so what happens is that the chondrocytes, the blood supply is lost, and the chondrocytes undergo hypertrophy and they die off. This is followed by ingrowth of blood vessels which carry osteoblast into this center, and this osteoblast will actually now line up the cavities left behind by the death of the chondrocytes, and these will now lay down bone. Remember that bone grows from outside in. If you look at the osteon or Haversian system, then the outer lamellae are older than the more inner or central lamellae. So remember that bone grows from periphery to the center. So you can see over here that the bone is being deposited within this, and gradually the diaphysis is transformed into a bone. However, the epiphysis is still present over here. Subsequently, the epiphysis between the epiphysis and the diaphysis, there is this epiphyseal cartilage which will persist till about the age of 20 years, when bone growth will stop and it will be overrun by bone. So you need to look at this. We will see this the disposition of this epiphyseal cartilage in the lecture demonstration that follows immediately about 10 minutes afterwards. So I will start the demo at 11:35 a.m. It will continue for about half an hour. Thank you so much for your patient listening, and I will also like to remind you once over again, don't ask me questions in the chat box, because people are misusing the chat box. Please ask me question on the WhatsApp group, and I will answer them, so that and all the students in your class can also gather that additional information from that medium. Thank you so much.
आप ऐसा एग्रीकल्चर के आते हैं सर।
Welcome back to the demo part of the class on connective tissue 2. And before I go on to connective tissue 2, I will like to refresh your memory and show you certain additional features of the previous demo class on connective tissue 1. Now if you see over here, can you recognize this tissue from the previous class? If not, let me tell you, this is a section of the aorta. Remember, aorta I had shown you to talk to you about elastic fibers being present in connective tissue. Aorta is an example of elastic artery, and they are very rich in elastic fibers. So this is the appearance in an H&E stain under low power. You can see these dots. These are the nuclei of the smooth muscle cells. Remember, the elastic fibers and connective tissue within the tunica media of the aorta is produced entirely, I repeat, entirely by the smooth muscle cells. So you don't need fibroblast all the time to produce the collagen and the elastic fibers. So here, this is under low power, and you can see this is the surface, that is the on the internal aspect. You can see here the tunica intima, and this is the very thick media, smooth muscle cells and elastic lamellae, and this is the tunica adventitia, which is present over here. This is the loose areolar tissue just outside the aorta, having lot of adipocytes. These are adipocytes, and blood vessels also, artery and vein. You know the vasa vasorum, that is the blood vessels in the tunica adventitia, which supply the blood vessel itself. So you know also that probably blood vessels also require blood vessels to supply themselves, and these blood vessels are known as vasa vasorum, which are present over here. So let us see this under higher power. The slide is not moving forward. Let me see. Just a minute. Give me some time. I will call the attendant and I will try to set this right. The slides are not moving ahead.
ये सर इससे होगा आगे। हाँ क्या हुआ, इससे हो जाएगा कि सर ऐसे।
Okay, so let us go to the next slide, and you can see under higher power these nuclei are of the smooth muscle cells, and you can see the elastic fibers and collagen fibers over here, and you can see some of the fibers are wavy, and these are the typical elastic lamellae. You know, elastic fibers are stained to a slight extent with hematoxylin, so you expect to see some outline of the elastic fibers also in an H&E stain, and this is the basophilic nucleus stained with hematoxylin. You can see some of the wavy elastic lamella over here. These stretch out when the aorta is dilated, filled with blood, and they become like this when the aorta, when the blood is going to the next segment of the arterial tree. So coming back to the normal dimension. So after this, मनोहर, ये तो सब गड़बड़ हो गया. ये तो पावर पॉइंट प्रेजेंटेशन है. जिस तरह से हमने पहले किया उसी तरह से कर दो. ये तो उल्टा, मतलब उल्टा चल रहा है. ये जैसे आपने इसके पहले पावर पॉइंट स्लाइड चला दिया ना, उसी तरह से चलेंगे. क्या प्रॉब्लम हो रहा है? आप बैठिए, आराम से बैठिए, आप उसको करिए. अभी तो आपने चला है इतना अच्छा से, अभी क्या प्रॉब्लम हो गया? दोबारा उसको सेव करना है, सेव करके दीजिए.
ये सर उसमें आ नहीं रहा सर, उस वाले में उसमें आ नहीं रहा, जैसे उसमें किया था ना पहले वाला.
यदि पहली बार जैसे किया था उसी तरह कर दीजिए. हमें इसमें प्रॉब्लम हो रहा है, स्लाइड नहीं आ रही ठीक से सीक्वेंस में. आपको क्या प्रॉब्लम है? इसको चेंज कर देंगे. आपको पेन ड्राइव चाहिए तो बोलिए, कर दीजिएगा.
So sometimes you have to press enter, sometimes you have to press that down button. Then it was an issue.
हमेशा होता है. नहीं, बस लास्ट टाइम वो शो देना तो
उसमें नहीं आ रहा, वो ऐसे ही आ रहा है, ऐसे ही आ रहा है, वो नहीं आ रहा उसमें.
आप ना प्लीज़ रिक्वेस्ट करके ये बड़ा सा लैपटॉप डेस्कटॉप ले लीजिए जिस पे रैम ज़्यादा हो. म्यूट है ना? म्यूट है ना?
ठीक है. नाउ आई विल प्रोसीड इन द सेम वे. आई हैव गॉट द पॉइंट.
अच्छा
you are having this problem also.
Yes, sir.
So I will just proceed as you have told. ये
इस पे करेंगे ना तो नेक्स्ट जाएगा.
ठीक.
ये तो नेक्स्ट जाएगा.
पर ये फुल स्क्रीन नहीं आएगा ना?
I think you are also facing the same time because the file is very huge.
Yes, sir.
That is the reason.
And this one is not good RAM.
Not good RAM.
You have to upgrade this.
Upgrade.
वो ऐसे ही आएगा सर.
ठीक. I will continue.
मैं वॉइस कर दूँगा.
हाँ. So there are some issues over here. I am not very sure about them, but let me continue as the way the slides are coming. I will keep on telling you appropriately. Now this is this section is actually, can I rotate this section? Yes, I can. Okay, this is the end of a long bone, and what you are seeing over here is fibrocartilage. This is the end of the long bone, and what you are seeing over here is articular cartilage. Remember articular cartilage? It is present at the joints where they are covering the ends of the bone, long bones. And if you look at this articular cartilage, which is a example of hyaline cartilage, it does not have a perichondrium. This is the only example of the hyaline cartilage which does not have a perichondrium. And you can see that within the articular cartilage there are various zones. The superficial zone, the cells are flattened, and then as you come to the deeper zone, the cells are more rounded, and these are the chondrocytes, and some of them are forming cell nests. If you go still down to the deeper layer, you see that some of the chondrocytes are now arranged in radial arrays in like this. They are arranged radially. So instead of forming cell nests or placed irregularly, they are present in columns. And still after that, this is the calcified matrix, and after that this is the spongy bone. So this is the fibrocartilage, but I will show that later to you. Just think about the articular cartilage at the end of the femur. Now, from where I have prepared this is from the rat. I have prepared in my own lab. So I have taken a section of a bone, long bone, I have decalcified it, and I have now stained it with hematoxylin eosin. And when I have stained it, I can see the cancellous bone inside and containing bone marrow, and I can see the articular cartilage on the surface, and the chondrocytes are the shapes of the chondrocytes vary depending upon their depth from the surface. Superficial ones are flattened, the deeper ones are in groups, and the deepest ones are present in columns, and finally there is a calcified matrix at the deepest layer. Now in this place you can see the this is again from the rat. You can see the now under lower power. Actually the slides have all got mixed up. This slide should have come before and the preceding one should have come after, but we can always clarify issues once the physical classes start in your curriculum. So here you can see the articular cartilage. Here again there is articular cartilage, and in between you can see the fibrocartilage. This is the knee joint, so this is the articular disc, and you can see the disc attached to the capsule of the knee joint with the periphery. This is only on one side of the knee joint, and this is the same articular disc I have told you about. This is the cancellous bone. See, or cancellous bone is also known as spongy bone. So you can see over here the bony spicules are present. The bony spicules are present. These are trabeculae, and they are lined on the surface by cells. Can you see? If I go to the previous slide, you will see them better. You can see on the surface of this bony trabeculae there is a uniform lining of cells. Many of these cells are osteoblasts, which are synthesizing the bony matrix. The moment they are trapped in the bony matrix, they will be converted into osteocytes. So inside, when you see these bluish dots, which are representing the nuclei, these are osteocytes. On the surface, when you see them, these are osteoblasts, and they can be, as you have seen in my lecture, as you heard from in my lecture, they can be either active or inactive. Oh my God, all the slides have become haphazard in their arrangement. I don't know what is the problem with this, but let me explain this to you. This is a part of a Haversian system or osteon. This is the osteonic canal containing the blood vessels, nerves, etc. and you can see the lamellae being arranged, and between the lamellae you can see the lamellar the arrangement of the lamellae, and between these lamellae there are lacunae which are containing osteocytes. You can see this cavity within. You can see the osteocyte, and if you look carefully you will see the fine processes coming out from the osteocytes. You can see this canaliculi over here going through, and these canaliculi will communicate with the osteonic canal. They will also communicate with the surface of the bone, and this is how the nutrition is maintained within. So osteocytes are living cells, they are not dead cells. So here again this is a section of the bone from a slide that you will see during your physical classes. You can see so many osteons over here. This is the osteonic canal surrounded by lamellae, and you can see from the some of the osteons there is a communication. There is a canal going out like this, either transversely or obliquely. These are nothing but perforating canals or Volkmann's canals. You have read in biology classes in your school. These are Volkmann's canals, and they communicate with the surface. They bring in blood vessels, nerves, etc., connective tissue, etc. So these are the difference between the this and this is how do you identify this? You can identify this by looking at the lamellae. The lamellae are arranged circularly around the Haversian canal, but they are not arranged around the Volkmann's canal. So Volkmann's canal will traverse diagonally across the traverse across the osteonic canal. So you can see over here there is these lamellae are actually surrounding this. They are not surrounding this. So these will not be surrounded. The Volkmann's canal will not be surrounded by the lamellae, which is the case for the Haversian canal. So this is how you differentiate these two structures. You can see this is a Volkmann's canal, beginning of Volkmann's canal. Here are other Volkmann's canal, here Volkmann's canal. So wherever you see these transverse or diagonally oriented channels, these are coming out from the osteonic canal. These are Haversian, these are Volkmann's canal. This is under very low power of the microscope. You can see this is bone, and you can see the osteons over here, and if you look between the osteons, then you will see some irregular lamellae over here. These are the interstitial lamellae. Now these osteons are arranged along the long axis of the bone, and each of these lamellae, if you see in the previous slide, each of these lamellae would be about 3 to 5 microns in diameter, and you can think that there will be innumerable osteons present along a long bone like the femur and arranged along the long axis of the bone, and they will be providing the support to the bone. So you might be wondering how this section has been prepared. Remember, this is not H&E stain. You don't see either purple or you see pink in this slide. So how it is prepared? We take a piece of bone and we have we grind this piece of bone on a stone. We keep on grinding it till the bone tissue becomes very much thin, and it becomes so thin that light passes through this section. So what will you call these sections? We call this section ground bone. The bone grinded till it becomes so thin like a scale that light is allowed to pass. This is not stained with either hematoxylin or eosin. Again, a low power. This is the whole piece of bone that I have taken under the photograph of which I have taken under the microscope. You can see that how the osteons are arranged, how the Volkmann's canals are there, and it's a beautiful figure of an adult bone showing the arrangement of the osteons. And you can see most of the osteons are arranged at right angles to this section. So this section is probably a transverse section, and most of the of these are arranged along the long axis of the bone. So here you can see again the osteons. You can see the lacunae containing the osteocytes, and here you can see the bony surface. The photograph has not been taken very appropriately, I admit it, but in certain areas you can see osteoclasts. Look at this cell. Within this is the bony surface within the cancellous bone. This is bone marrow. So you can see at one place the osteoblasts are very much thin in appearance. In another place you can see the osteoblasts are cuboidal in appearance, and in another place you can see this cell. In this cell you can at least see three nuclei. At least see 3 nuclei, and very extensive cytoplasm, and there is a gap over here between the bone tissue and this cell. This is nothing but the multinucleated giant osteoclast cell. Now I told you that there may be up to 10 to 15 nuclei in the osteoclast. Remember that this is only one part of the osteoclast. The osteoclast will occupy a 3-dimensional arrangement, and a section has gone through only one part. So all the nuclei will not come in this, but yes, you can appreciate the large and extensive amount of cytoplasm compared to the osteoblast over here, and you can also identify the ruffle membrane over here, and you can also identify the Hochschiff's lacunae over here. So remember, at places you will probably these are also osteoclasts, but only a part of the cell has appeared, and you can see how it is removing bone, and this may be the ruffle membrane. You are not seeing all the nuclei because it has only gone through one part. These are the osteocytes. These are the osteocytes. Now often we find that the students call the bony trabeculae within the bone, within the spongy bone, as immature bone. It is not correct. Immature bone is formed during the development of the bone, and whenever there is a bone fracture or something, then the bone will be formed, and predominantly that is what is happening. And when there is remodeling of bone, immature bone is formed, but the amount of immature bone formed is so little, so minuscule, that you are not able to see it under the microscope. You may see it under the electron microscope, but not under the light microscope. So what is this type of bone which is present in the spongy bone, spicules or trabeculae? You can clearly see lamellae within them, and lamellae arranged like this is an example of mature bone. However, these lamellae don't form osteons. So the difference between spongy bone and compact bone is that in the spongy bone the lamellae are arranged parallel to each other, but not to form the osteons. So it is lamellar bone. In the compact bone, it is also lamellar bone, but the lamella are arranged in a specific manner to form the Haversian systems or osteons. I hope I have made this quite clear that both are mature bone, both are made of lamellae. Only at one place it is forming osteons, other place it is not able to form the osteons, because continuous remodeling is going on, and also bone marrow has to be present over there so that the blood cells develop from there. Another place where you see the bony trabeculae, you see the bone marrow, and you can see beautifully over here, like an epithelium, the osteoblast present over here. You can see sticking out from the bone surface a single layer of cells. Some of them are flattened, some of them are tall, and this is what the picture appears of the osteoblast cells. Some are inactive, forming a thin epithelium, some are active, forming a cuboidal, almost columnar epithelium, and wherever you look, you will see this type of appearance. You will see this type of appearance. So these are the osteoblastic cells. mixed up within them will be the osteoclast, but osteoclast will usually be within some depression, like a as I mentioned before, the resorption base on the horseshoe lacunae. So here again you can see the surface of the bone. See the clear pattern, the lamellae arranged over here. These are the osteocytes and these are the osteoblasts over here. They are looking cuboidal to columnar. Again the same thing, I will not go into this. This is a spongy bone seen from a section. Many of these pictures which you see has been prepared in my lab, while this one is a section which is from the histology lab, and this is an example of a spongy bone. I am showing you both, so if you are given this type of slide, you don't get confused. You can see the trabeculated appearance of the bony tissue. You can see the bone marrow within it, but unfortunately the cellular outline is not so clear here. That is why I have this is from the human. That is why I have taken from the animal, where we have been able to preserve the cellular outline of the osteoblast quite clearly. So again lamellar bone within the spongy tissue, and you can see so clearly osteocytes, etc. You can see the lacunae, you can see the canaliculi over here, and this is another example. You can see the flattened osteoblastic cells, inactive cells. I am coming to the previous slides later on. Here you see intracartilaginous ossification. We don't have slides of intramembranous ossification, but we have slides, so that you have to read from the book. So in intramembranous ossification, mesenchyme is transferred directly into osteoblast and bone is being formed. But in the endochondral or intracartilaginous ossification, mesenchyme is transferred into a cartilage model, and within the cartilage now the chondrocytes are removed and the osteoprogenitor cells are formed, which now take up the role of formation of bone. So this is an example of the endochondral ossification, and if you look from one side of it, you will see these are the resting cartilages. This is the resting cartilage, then this is the proliferating zone or proliferating cartilage, then this is the hypertrophic cartilage, and what you must see very carefully and very importantly is this is the periosteal collar. This is the periosteum. This is the periosteum which had laid down bone on the inner aspect. Now as soon, because blood vessels are coming from the periphery, so as soon as this periosteal collar, this is one of the most important identifying features of intracartilaginous ossification, endochondral ossification. A section with an endochondral ossification will always have this tissue over here. Remember, this is called bony collar or periosteal collar, and this actually stops the nutrition from reaching the chondrocytes, as a result of which the chondrocytes die off, they enlarge and they die off, leaving empty spaces. These spaces fuse with each other, forming cavities into which now there are periosteal buds coming in, carrying blood vessels, carrying osteoprogenitor cells, stem cells, which will now line these cavities and lay down bone. Remember, I told you bone develops from periphery to the center, and gradually this zone of hypertrophic cartilage is going into the zone of calcified matrix, where the osteoblasts are laying down bony matrix, and you can see this this is the bony matrix, and on the surface will be the osteoblastic cells, and here you can see this bony matrix. So if you see this basophilic appearance, this is the cartilage, and if you see the astrophilic appearance, this is the bone. So here in this piece you have both cartilage and bone, bone is astrophilic, and cartilage is hyaline cartilage is basophilic, and this type of appearance is called a mixed spicule. Mixed spicule. So, so here you can see this, and then coming to the next slide. Here again you can see this membranous ossification, intracartilaginous ossification, and you can see how bone. This is the periosteal collar, and these are the periosteal buds carrying the blood vessels, which will grow into this, carrying the osteoprogenitor cells. So I will go back. I'll go back, and I will show you at higher power the interior of this area. So you can see under high power what has happened is you can see the cells over here. These are basophilic, so bone matrix. These are eosinophilic. These are basophilic. So cartilage is over here. Wherever you see some basophilic appearance, eosinophilic appearance, I am sorry. Cartilage will be basophilic, so this is cartilage. Bone tissue will be astrophilic, so this will be the bone. So gradually bone is being laid down in the center by the cells. You can see the cells over here. These are the lining cells, the osteoblasts. This is a stain of a rat femur. With a dye called alizarin red, alizarin dye. Now, when you stain the end of a growing bone with this stain, you can see the articular cartilage over here, spongy bone. This is the epiphysis, and here is the growth cartilage. This is the growth cartilage, and this is the diaphysis. The growth cartilage means the epiphyseal plate. We don't have slides like this for teaching purpose. So, this is again from my lab, where you can see the very nice growth cartilage present between the epiphysis and the diaphysis, and you can see in the epiphysis from one side cartilage is growing, from another side bone is being formed. This eosinophilic appearance is the bone, and gradually when the with age, when the bone growth stops at about the 20 years of age, the most important hormone responsible for bone growth is the growth hormone or somatotropin. And somatotropin doesn't act directly; it produces a chemical in the liver called IGF-1. And this IGF-1 actually acts on the cartilage to produce the bone growth. So you can see over here the epiphyseal cartilage, and this is the articular cartilage. So you can see over here how the in the epiphyseal cartilage, I will not comment on this. I will move to the next slide. Again you see a section of the developing long bone, short long bone. Actually these bones are bones of the foot, or the bones which we also call as the phalanges. Phalanges. There is one reason for taking phalanges. Actually the ossification in the phalanges is very prolonged one. And you can see the cartilage model in the center of which you can see the bone deposition growing, and you can also see the periosteal collar on the outer aspect. So again the same thing, and you can see the cartilage model and the endochondral ossification. So you can somewhere here will be the periosteal collar, bone is being deposited. The cartilage has zones over here, like zone of resting cartilage, hypertrophic cartilage, then resting cartilage, hypertrophic cartilage, and then in between proliferating cartilage, and then osteoid deposition, and bony spicules, and bony spicules been formed over here, and this is the cancellous bone which is coming up, looking like a cancellous bone which is coming up over here within the shaft of the bone, long bone. So under higher power you can see again the endochondral ossification, and I am not going into this, and beautiful periosteal collar or bony collar you can see over here, and again you see the mix up of the bone and cartilage. Now this is, can you identify this tissue? Here you see the perichondrium on the surface. You can see chondrocytes, but they are isolated. At few places they are in pairs. They are in pairs. So students, can you tell me what tissue is this? Yes, if you have guessed it right, this is elastic. Yes, this is elastic cartilage, and you know from where we have taken this. This is from the pinna, that is from the auricle. So you know the auricle has a skeleton as a framework of elastic cartilage. So this is the cross section. This is under higher power. Actually all the slides have become haphazard. I would have liked to show you the low power image first, then come to this, but unfortunately the high power has come first. So you can see the chondrocytes. See, the chondrocytes have retracted from the surface. The chondrocytes have retracted from the surface. This is due to the processing of the tissue. This is due to the processing of the tissue, and this is due to the processing. This is otherwise in the living condition, the entire cell would fill the lacunae. There is no gap. The lacunae is an artifact appearing following the histological processing, where the cell surface retracts from the lacunae, creating an artificial space within it, and the cell is also little bit deformed, and you can see the superficial cells are flattened, the deeper cells are all rounded, and you can see the very extensive matrix over here, and the matrix is slightly eosinophilic because elastic fibers are stained by the hematoxylin and eosin. There is a mix up with elastic fibers and the collagen fibers. Now remember, cartilage contains collagen type 2. Type 2 fibers form fibrils, but they don't form bundles. Collagen type 1 forms fibrils which aggregate into bundles. So there is a difference between the bone and cartilage. So I come back to this tissue. This is the aorta, and you can see under higher power, you can see the wavy nature of some of the structural elements over here, and along with them you can see these spindle shaped elongated flattened nuclei. These are the smooth muscle nuclei of the smooth muscle cells. So this is still under higher power, the aorta. Now I am sorry again, this is the pinna, but it has been stained with a stain, specific stain. I mentioned to you in my last lecture. You will see elastic tissue can be stained with Verhoeven stain. Other stains are resorcin fuchsin and orcin. This is for the postgraduates. So resorcin fuchsin, orcin or Verhoeven. This is Verhoeven. You can see the elastic fibers in the auricle of in the elastic cartilage of the auricle stained beautifully black in color, because this is the stain for the elastic fibers. This is the pinna or the auricle. You can see under very low power how it looks, and see it is lined by stratified squamous epithelium. I have don't ask me questions. I have already told you not to ask questions to me during this time. So this is the stratified squamous epithelium on one side. This is the stratified squamous epithelium on another side. So you can understand that if I have cut a section through the auricle, the elastic cartilage will be surrounded by some connective tissue, there will be perichondrium immediately adjacent to it, connective tissue, and there will be epithelium on both sides. So you can see the epithelium, stratified squamous epithelium on both sides. These are all identifying features for the elastic cartilage. So now you can you can see the stratified squamous epithelium again. You can see the perichondrium over here, and you can see the elastic cartilage over here. The arrangement of the chondrocytes is so very different from the hyaline cartilage. This is fibrocartilage. Now, in fibrocartilage, you will see chondrocytes which are present in rows. You can see the chondrocytes which are present in rows. These are chondrocytes which are present in rows. So, these cartilage part, these are the collagen fibers. These are the collagen fibers, and these collagen fibers are produced by fibroblast, whose nuclei you can see over here. The chondrocyte nuclei are little bit oval in shape, and because chondrocytes are per se rounded cells, but when you look at the fibroblast, you will see that they are very much flattened cells. The nuclei is very much flattened, and they are present actually isolated, while the chondrocyte nuclei are present in rows, or even they will be present in isogenous cell group in certain areas. So you can see the collagen fibers very nicely over here, very nicely over here. So if you look at the at another magnification, so what I am telling here is, it is an fibrocartilage is an aggregation of a dense connective tissue, along with hyaline cartilage. So hyaline cartilage will be having chondrocytes, collagen type 2 fibrils, while this is dense connective tissue. These are collagen type 1 fibers, and the nuclei of the fibroblast can be seen in isolated positions. So now some textbooks call the dense connective tissue. Some textbooks call the dense connective tissue as regular over here, because you see the many of the fibers are arranged in one direction. However, this is under low power, the fibrocartilage, and if you look at the fibers, you will see that they are arranged in different directions over here. See over here, as if they are looking like feathers. Don't mention it in your exam. They are looking like kind of, some fibers are directed in this way, some fibers are directed, you can see some fibers are directed in this way, some fibers are directed in this way. So as if the fibers, the bundles of fibers have been formed at different times, and they have been arranged in a specific manner dependent upon the stresses encountered at that time, the body weight, etc., the movement, etc., which are placed on the intervertebral. This is from the intervertebral disc. Remember, the intervertebral disc is the best example of fibrocartilage. Other example of fibrocartilage is the pubic symphysis, are the articular discs. Have I given you examples of the immature bone in the adult? Do you think immature bone will be present in the adult? Yes, they are present wherever bone remodeling is going on. But if you look at the in the root of the teeth, then the dental pulp, around the dental pulp, there will be immature bone present. Immature bone is oven bone. If you look at the attachment of some tendons to the bone, then immature bone will also be present. So it is important that you know where immature bone is present, or oven bone is present in the adult. I have given you two examples. One is in the sockets of the teeth, And another example is certain tendons getting attached to the bone, and at that attachment point there is oven bone or immature bone. So fibrocartilage, I come back to the topic, the fibrocartilage you can identify by the irregular and often the feathery appearance of the collagen fibers disposition, and in between you see the bluish colored nuclei. These are the nuclei. If they are together and in rows, they are the chondrocytes. If they are present as isolated, then they will be the fibroblast. So again you can see the different directions of the taken up by the collagen fibers in the fibroblast. These are collagen type 1 fibers, remember, and in between you can see these blue dots. These are the chondrocytes, and flattened elongated nuclei, they are very large. These are the they are larger than the chondrocyte nuclei. These are the fibroblast nuclei. You can see in a very beautiful manner over here the axial orientation of the chondrocytes and the fibrocartilage. You can see the nuclei arranged axial means in rows. You can see in rows, and in between you can see some flattened nuclei, and you can see it so clearly over here. This is in relation with this collagen fiber bundle. This is in relation with this collagen fiber bundle. So this collagen fiber has been formed by the fibroblast. Remember the name fibroblast, associated fibroblast. The fibroblast is responsible for the genesis of all the three types of fibers. So you can see over here the very close attachment of the fibroblast with the collagen fiber bundle. Again beautifully you can see the fibroblast, collagen fibers. If you look at it, it is looking like a regular dense connective tissue, and regular dense connective tissue. Actually that is what is written in the textbooks. So you can say that it is the fibrocartilage is the mixture of hyaline cartilage with dense regular connective tissue. Irrespective of what I am mentioning over here, depending upon the variable directions of the collagen fibers within the fibrocartilage. So you can see over here, this is a chondrocyte nuclei, you can see, and but it is isolated. So if it is isolated, I told you it has more chances of being a fibroblast nuclei. So it may be a fibroblast nuclei which is active. You can see the extensive amount of cytoplasm, and it is also associated with the collagen fibers. So this is an active fibroblast nuclei, and this is a resting fibroblast nuclei. Collagen fiber bundles. See how beautifully you can see the collagen fiber bundles over here. This is towards the this is the fibro. This is the section I was showing over here. Now I have gone to the periphery of this section. So you can see fibrocartilage over here, and as you go towards the periphery, you see the connective tissue over here. Remember, fibrocartilage does not have perichondrium. So what you see over here is connective tissue containing blood vessels. So there are some connective tissue over here containing blood vessels, and again there is extensive collagen deposition over here. Now let us look at the hyaline cartilage. Which section is this? This is from the trachea. You have seen the epithelium of the trachea before. You have seen just below the, I have told you, just below the epithelium is loose connective tissue known as lamina propria, filled up with all kind of immune cells, etc. And this is the hyaline cartilage. Look at the matrix. Collagen type 2, I told you, it is basophilic, so it is taken up very nicely, the basophilic stain. And look at the nuclei. The nuclei are usually 2, 3, 4, 5 like that. These are isogenous cell groups. Look at the periphery. This is the perichondrium, and look towards the periphery of the cartilage. The cells are flattened, chondrocytes, but here they are properly disposed chondrocytes. This is under higher power. You can see the collagen deposition within the matrix, and you can see the territorial matrix. you can see the interterritorial matrix which is lightly stained. This is because of the extensive deposition of gags over here in the around the territorial matrix. Again you can see the territorial matrix nicely, interterritorial matrix, and the chondrocytes forming large groups. You will not see this type of appearance in either elastic cartilage or fibrocartilage. I'll come to this slide later. This is now I want to show you something very amazing over here. Can you recognize the section? This section is the section of loose connective tissue, also known as areolar tissue. Why areolar tissue? Because there appears to, areola means cavities, there appears to be large cavities inside over here. So, so it is called also known as areolar tissue. There are different nuclei. I think I have one slide where I have labeled them. Let me see if I have labeled them somewhere. No, I don't think that section has come up till now. So I will just go back, and you can see a capillary over here. You see another capillary over here. You can see the capillary branching over here. So this is a beautiful picture of a capillary with elongated endothelial cells present over here. Apart from that, you can see the blood vessels also over here. But where you can see they are very much stretched out. These are collagen fiber bundles. And where they are thick and where they are very thin, they are elastic fibers, and these are the nuclei. I have a label section. I will show that to you later, and because I label them myself in one section, one slide, and you can see most of the nuclei doesn't have a very nice cytoplasm around this. These are the fibroblast nuclei, and some of the cells are larger. See this cell. See this cell. These are larger cells. See this cell. This is a typical mast cell. This is a typical mast cell, and I have also a plasma cell over here. This is a plasma cell. See, the nucleus is towards the periphery. It is having a cartwheel type nucleus, and the cytoplasm is very extensive. This tissue appears like this under low power. So many students get confused. They are not able to identify. So you should see the tissues during the physical classes under both low power and high power. Low power you hardly see anything except a spread of the mesentery, and mesentery, that is from the which binds the viscera in the abdomen, and blood vessels within them. This is an artifact. These are artifacts. Don't look at them. Look at these. These are capillary blood vessels, and this is the. And when you put this under higher power, you see this. Again, the same thing, different field. You can see the beautiful. I have never seen like this in any other tissue. This type of capillary, how they are branching, and endothelial cells, and you can see the different types of fibers over here, and you can see the mast cell over here. The cytoplasm can be seen nicely, and these granules, remember I had mentioned in my lecture previously that these are basophilic granules, but once they are degranulated, they appear eosinophilic. So apart from this, I am not able to pick up some further cells with much emphasis or correctness, so I will not mention them to you, but you can, the moment you see nuclei like that without a cytoplasm, you remember, you identify them as fibroblast nuclei. If they are very nicely basophilic stained, they are resting. If they are having less of basophilic stain, they are active. This type of chromatin is known as euchromatin. This type of chromatin is known as heterochromatin. And within this, you get cells like this, which are larger in cells. And this is, I am sure, this would be a mast cell. Though for correct identification, we need to stain this with the toluidine blue. Now this stain slide I have not shown to you earlier. I actually forgot to show this slide to you earlier. This is a very specific type of stain. This is a specific type of stain. This is the Maschan's trichrome stain. Maschan's trichrome stain. Maschan's trichrome stain, and actually what has happened is, I think a different file has been opened. A different file has been opened with the incorrect slides. Now I get to the root of the issue. I will try to upload the correct file with the labeling etc. Somewhere in the class or in the WhatsApp group, so that you know the labels. I had put labels over here, but I think a different file has been opened due to some mistake, either of me or of the associated people. So here this is a specific type of stain called Maschan's trichrome stain. Maschan's trichrome stain. And मनमोहन जी, आप अगर ये मेरे बात सुन रहे हैं तो आप LT में आ जाइए, मनमोहन जी. So you can see over here, Maschan's trichrome is stains the collagen fibers green or blue. You can see over here that the Maschan's collagen fibers towards the superficial part of the, this is the dermis, this is the epidermis. This is stratified squamous epithelium. You don't see hair follicles over here, keratinized stratified squamous area. You can see the loose connective tissue over here. This is the papillary layer of the dermis, and the majority of the dermis is the reticular layer of the dermis. You can see the very nice wavy kind of collagen fibers over here. Elastic fibers are also wavy, but elastic fibers are not being seen here. These are the collagen fibers which are being seen, and you can see that the skin is often stretched during our day-to-day activity. At the stretching of the skin, it is necessary that the collagen fibers become wavy. So apart from elastic fibers also, so you can see in the superficial layer the collagen fibers are not so aggregated, but in the deeper layers they are very nicely aggregated into thick bundles. These are blood vessels. These are blood vessels, and some of these are sweat glands. So Maschan's trichrome is basically done to identify the collagen fiber bundles which are stained blue or green. Here it is stained, there are two variants, here it is stained green, and the muscle cells which are stained red. So muscle is not here, so you don't see them. Now this Maschan's trichrome stain can also be used to stain the kidney. Now wherever there will be collagen fibers in the kidney, it will be stained green. If you look carefully, you will see the glomeruli over here within the kidney. You must have read about them, but this is the actual section of a kidney stained with Maschan's trichrome, and you can see around some places there are green areas. There are green areas. These are the areas where collagen fibers are present. So you can just play with the dyes. You can take up any tissue and just stain them and see where all the collagen fibers are present. This is a cancellous bone again, and you can see the epithelial lining of the cancellous bone. I think we have come to the end, and these are just repetitive slides which are coming up. So Manmohan ji, आप please LT में आ जाइए. Students, I will just try to open the other file which contains the label diagrams. I will not teach you anything about that, but I'll just show you the labeling. Just wait for a few minutes. I'll try to call the LT attendant. I am not able to locate the LT attendant, unfortunately. So this file, I end the demo here. The correct file of these photographs I have put in a graded manner with each tissue in under low and high power, not mixed up as in current file, and with labeling at certain points. So I will try to upload that separately, so you can just spend some time looking through those slides, and also I will, if you have any queries, I can answer to you in the WhatsApp group. Besides that, if you want me to take a brief demo of those slides with labeling, you can also request that in the WhatsApp group, and I will try to find about 5-10 minutes time in between some other day to explain to you the remaining those slides in the demo. Thank you very much for your patient listening, and so I end my class at the present moment.
आ रहे हैं सर?
हाँ, ये दोनों में आता है।
ये ख़त्म हो गया क्या अभी?
हाँ, कुछ स्लाइड का कुछ प्रॉब्लम हुआ तो लगता है, आ रहा हूँ। ये राजस्थान में इसको बुलाया गया तो मैं तो थोड़ी लेता हूँ। ये जो फाइल जो पूरा है ना, गलत फाइल है। ये दूसरा वाला
जो डेमो वाला जो था,
हाँ उसको बंद करिए आप। ये वाला फाइल को बंद करके एक और फाइल है उसको आप खोलिए। ये ना
आपने ये वाला बोला था सर?
हाँ हाँ ये वाला कनेक्टिविटी इशू 2 डेमो।
ये वाला?
हाँ अभी भी स्टूडेंट्स कोई है?
अभी तो सर
है
ये अभी
कुछ
ये लोग
कुछ है स्टूडेंट्स?
हाँ जी सर,
है तो
12 लोग हैं सर।
12 लोग। थोड़ा माइक ऑन कर दो। So those of you who are present online, let me tell you we are opening the new file with the labeling. Just be here for few minutes. उसको आप वो कर दो, स्टार्ट कर दो वो फाइल को जो आपने अभी पेस्ट किया। मुझे पहले ही शक हो रहा था।
नहीं, मैंने आपने सब मेरे को 3 बोला था।
हाँ हाँ आपको मैं वो नहीं कर रहा हूँ, आपको ये भी बोल रहा हूँ कि आपने गलत फाइल, मैंने गलत फाइल शायद बताया होगा आपको। मैंने वही वाला दिखाया जो आपने खोला है ना? हाँ तो वो मेरा गलती है, मैं मान रहा हूँ। अच्छा ये ऑनलाइन गया कि नहीं देखिए तो? ये लग रहा नहीं गया क्योंकि वो सब नहीं खुले हैं जो आपके।
नहीं आ गया सर।
इसको अगर लेते हैं ज़रा।
हाँ जी,
अच्छा इसको लोड करना है।
ये तो कर दिया मैंने, कॉपी पेस्ट कर दिया सर।
नहीं नहीं इसको ऑनलाइन में लोड करना है। ऑनलाइन में आपने यूट्यूब में जाएगा ना फाइल, वो वाला पीछे वाला फाइल को बंद करके इसको भेजिए यूट्यूब में।
नहीं ये यूट्यूब पे भी गया हुआ है सर, ये दिखाता हूँ।
ये भी गया यूट्यूब में?
हाँ जी।
दोनों चला गया? ये कैसे हो सकता है? मतलब लेक्चर वाला और 2 डेमो वाला? ये भी चला गया यूट्यूब में?
हाँ यूट्यूब का सुन।
अच्छा अच्छा, ठीक है, आप थोड़ा सा उधर जाइए, मैं अभी 1 सेकेंड में आपको देता हूँ. So this is the actual file I wanted to share with you. So you can see, I'll just be very brief. You can see the blue arrows over here. The blue arrows, this is loose connective tissue, areolar tissue from the mesentery. If you see the blue arrows, then these are referring to the collagen fibers. You can see the collagen fibers, blue arrows. The red arrows are referring to the elastic fibers. They are very thin, very branching. Collagen fibers don't branch, elastic fibers branch. And then you can see the mast cells. This is a mast cell, this is a mast cell, this is a plasma cell. And you can also see the capillaries which have been also marked. So these are blood vessels, and this purple arrow, this represents only the nuclei, no cytoplasm is stained. So this is the fibroblast nuclei. These are artifacts. These are artifacts. So this is a labeled slide of the loose connective tissue. The previous section on the low power, you see this, and here I have mentioned this clearly: loose and dense irregular connective tissue from the skin. And what is the stain? Mason's trichrome stain. There are 3 different dyes in this, and 2 of the dyes are very clear. One will stain the collagen fibers green, other will stain the muscle fibers red, and a third stain is for the blood. So Mason's trichrome, you can follow it out in the net why it is called trichrome, and you can see the green color which is clearly the collagen fibers, and this is the epidermis over here. This is the dermis. Superficial part, the papillary layer is loose connective tissue, and this having the collagen fibers in different directions. This is the dense irregular connective tissue. This is the elastic artery under different magnification and different dyes, low power, high power. You can see the smooth muscle cells, elastic fibers, collagen fibers, all are stained over here because this is H&E. But this is only staining the elastic fibers. This is the special stain for elastic known as Verhoeven stain. And this is under low power, and this is under high power. You can see the wavy elastic fibers over here. Collagen fibers are also wavy to some extent, but elastic fibers are more wavy. This is the hyaline cartilage at different magnifications, low power, then high power, higher, and maximum. So you can see the hyaline cartilage, and particularly you when you look at isolated sections of the hyaline cartilage, you may get confused, because in this section you will not see the epithelium, you will not see the other perichondrium, so you may get confused. So that is why I have put the figures in this panel. You can see only the chondrocytes and the matrix and the territorial matrix, etc. in this picture. This is the elastic cartilage. You can see the hematoxylin eosin stain and the Verhoeven stain, the special stain. This is the fibrocartilage at different magnifications, and you can see clearly the arrangement of the collagen fibers over here. See this arrangement. You can see the cells in the rows, fibrocartilage, and in between you will see some cells. These are the fibroblasts. These are the chondrocytes where they are seen in rows, and these are the fibroblast nuclei. And these are the bundles of collagen fibers. Peripheral part of fibrocartilage, I have all. This is the fibrocartilage, and this is the peripheral part. Remember, there is no perichondrium over here. This is connective tissue with blood vessels, etc., and collagen fibers are being formed here also. This is the kidney stain, Mason's trichrome, the same stain with which, excuse me students, I'll just take a phone call. I am just reaching in few minutes, okay? Okay, you be there, huh? Okay, you be there. You be in that room. I'll just come in. Okay, okay. And Maji comes. You call Maji also there. Okay, okay. So this is the kidney. I have shown this to you earlier. The only difference is here they are properly labeled, so you don't have any confusion regarding the slides. And they have been put all in a panel form, so you can see go from low power to higher power and easily understand how the different types of how the different parts of a tissue is arranged. So from one Haversian system you can see the whole bone, spicule of bone, and you can see the multiple Haversian system, lamellar bone, etc. And this is cancellous bone. You can see the spongy appearance of the cancellous bone. Each of these is a trabeculae of bone, and on the surface of the trabeculae you can see this arrangement of the osteoblasts and the osteocytes within. This is under higher power, the cancellous bone. You can see the osteocytes within, the lamellated appearance of the bone, and you can see the bone marrow over here, and the perichondrium is over here, and one of these has been highlighted, and you can see the lining epithelium. At places it is cuboidal, at places it is very much flattened. These are the osteoblast cells. This slide I have already shown you for the osteoclast. So this is a bony cavity. You can see the osteoclast having multiple nuclei over here. Again you can see over here the osteoblast and osteoclast osteoblast and osteocyte. So osteoblast over here, I am not showing you this, I am showing you this osteoblast over here and osteocytes in the inside, and this is the lacunae with caniculi, etc., bone marrow. This is the slide from your from the department, and you can see the spongy bone very nicely over, though the stain is slightly less, but you can see, you can appreciate that bony trabeculae branching and anastomosing with each other to form a network like arrangement, and this is the bone marrow in between. The surface epithelial cells are not seen, but you can see that they are very nicely seen in these sections from the animal bone. This is the intracartilaginous or endochondral ossification, different magnification, and please identify this periosteal collar here, and you can identify the also at places the periosteal buds are forming, maybe at a still higher power, and the different zones of the calcification. You can see the periosteal collar so nicely over here, and you can also see the bone is being formed over the cartilage matrix. The cartilage matrix is bluish in color, and wherever bone has been formed, it has converted into astrophilic color, and obviously there will be osteoblast lining this place, so the bone is being formed on the surface. The bone will go from periphery to the center. This is the bone from the rat. Two types of cartilage over here. You can see the articular cartilage over here on the bony surface, and then spongy bone, and then this is the epiphyseal cartilage. This has been stained with a specific dye called alizarin red, and here you can see the different zones of the epiphyseal cartilage also, like from this side, if you go from the epiphyseal side, there will be resting cartilage, then there will be proliferating cartilage, then there will be hypertrophic cartilage. This is proliferating, this will be resting, this is the hypertrophic. I think I have a higher power view of this, I don't have it, so I will just focus on this. You can read it up from the book. This epiphyseal cartilage has multiple layers, the resting cartilage, then proliferating cartilage, then hypertrophic cartilage. The cells become large and they die off then subsequently, and then there is calcification over here. This epiphyseal cartilage, please understand, this is the cartilage responsible for growth of the bones, and it is placed between the epiphysis over here and the diaphysis over here. This is the articular cartilage I have referred to you earlier, and you can see the hyaline cartilage. There is no perichondrium, and you can see the superficial cells having the flattened nuclei compared to the deeper cells which are in groups and subsequently in columns, and then there is the calcified matrix over here. You can see the fibrocartilage over here. I have not put this under higher power because I don't want you to recognize the fibrocartilage under higher power of a rat rather, or an animal. I rather you see the fibrocartilage in the fibrocartilage in the human. That is all. Thank you so much. Thank you so much. Manmohan ji, one second. जाइए जल्दी जाइए, बंद करिए, वहाँ भी बंद करिए, रिकॉर्डिंग बंद करिए, हाँ, वीडियो को भी बंद कर दीजिए, ये जो आवाज़ आ रहा है इसको बंद कर दीजिए, बंद करिए, बंद करिए,
खत्म हो गया तो खत्म।
कर दो। इसको आप डाल दीजिएगा। थैंक यू।
सर पेन ड्राइव।
हाँ, हाँ। आप थोड़ा आगे से थोड़ा रहिएगा, नहीं तो किसी को बैठा नहीं करिएगा।